You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Adverse drug reactions, or ADRs, are a serious issue in healthcare today. The pharmacist is the last line of defense to help prevent ADRs. A rising role of the pharmacist is the specialist who focuses on our children. Pediatric pharmacy ensures safe and effective drug use and optimal medication therapy outcomes in children up to 18 years of age.
Hey everyone, welcome, and I hope you're a little bit surprised. It's normally Justin that starts off the podcast, but today it's me. So Mary Vong is here. I am Chief of Clinical Operations of Perfecting Peds, and I'm so excited to be co-hosting today with Brian Irvin, who's our new VP of Healthcare Architecture Environment. I already forgot the word. Brian, a few words?
Well, it is an honor and pleasure to be co-hosting with the Mary of Perfecting Peds. We have a lot of duplicate names, but there's only one Chief Clinical Mary. So thank you, Mary, for helping me be welcome onto the Perfecting Peds team and be co-hosting today and asking Tim a few questions of our own.
Awesome. So today's episode of the Pediatric Pharmacist Review is all about seasonal depression. We just had a huge change happen over the weekend. We all set our clocks backwards, which means that the days are going to become shorter. It'll become a little bit darker. So I wanted to have Tim Horton, who is a pediatric psych nurse practitioner who we work with so closely in Minnesota, speak a little bit about seasonal depression. Welcome, Tim. Thank you so much for joining.
Thank you for having me. I'm so excited to be here.
You want to start off with a brief introduction, Tim?
Yeah, so I'm a psychiatric nurse practitioner at People First Clinic, and I founded the clinic there. We specialize in kiddos, providing multidisciplinary care and then just team-based care, and that's where Perfecting Peds comes in so often with some precision-based medicine as far as like testing and just the care-based team that we kind of model. So that's a little bit about me.
Awesome. And then Jenna just popped in as well. So hello, Jenna. Thanks for joining us.
Hi, guys. How are you? Nice to meet you, Tim. I've heard nothing but wonderful things about you. My name's Jenna Quinn, CEO, co-founder, Peds Pharmacist of 14 years and mom of 3 girls. So very nice to meet you, Tim.
Nice to meet you too, Jenna. 3 girls. I have 1 little 3-month-old. You must have your hands full.
It's fun chaos. 8, 6, and 3.
Oh, yeah, you're busy.
It gets easier. Yeah, it is a good age gap, and I promise it gets easier.
Honestly, like my little one's sleeping 8 hours, so I don't know if it could get 8 easier than that.
Oh my God, you're lucky. That was never the case in the Quinn household, so that's awesome, Tim.
Love it. So today we're talking about seasonal depression, which I thought was very in tune with the time since the days are getting shorter. It might get a little bit colder. So we first wanted to talk to Tim about what biological or environmental factors do you think are thought to cause seasonal depression besides just the days getting darker? Because I know a lot of people have this theory about sunshine.
Yeah, no, most definitely. So we think it's a multifactorial process. We know less sun is hitting the back of our eye, and that causes changes within the brain. Certain changes essentially cause more melatonin to be created, and we think there's less chemicals available for, serotonin to be synthesized in those sorts of pieces, because all of our building blocks start with the B vitamins and those sorts of pieces. We also think, nature's healing in general. I don't have to tell any of you that most likely. So less time outside, less time kind of enjoying that sunshine really does impact people, and they're less active socially, those sorts of pieces as well. So we think it's a multifactorial process, and that kind of leads to certain changes within the brain.
Yeah, I feel like my cousins are very in tune with that because they just moved to Seattle, and I am literally just like in the sunshine all day in Florida. So my aunt doesn't believe that seasonal depression is real. And they were trying to explain to their mom, like, no, this is real. Like, we're moving to Seattle. It's going to be so much darker. Like, so many things are going to change. And their mom just does not believe it at all. But I do agree that sunshine plays a huge factor in it.
Definitely. And there's other factors too. So those assigned female at birth, we think they're a little bit more impacted, and certain other kind of, people are too. So it's definitely real. The research kind of proves that out.
Okay, I'll go next. Tim, how can lifestyle changes like light exposure, which we just alluded to, exercise or diet, help reduce these symptoms? I know for me, exercise is my sanity, but I would love to hear from you what tips and tricks you have.
Definitely. So exercise helps you build your brain chemistry, and essentially, give me 1 second here. Apologies.
This is even better. If we get a baby to join, then
we
I'll
always
have
welcome a cameo. Oh my goodness!
I know.
We love a good baby joining.
Yes.
Hello.
Hi, buddy.
Oh my goodness.
So
baby therapy definitely helps. I would say cuddling babies.
Oxytocin hit like right there.
Yep.
So lifestyle pieces definitely, are implicated in it. Exercise helps us build our brain chemistry generally. So if we're able to get good exercise in, that definitely has some research to support seasonal affective disorder. The B vitamins as well can definitely impact things. So a little front loading of that, healthy B vitamins within our food, those sorts of things as well. That kind of helps us build our brain chemistry and kind of fend off some of those difficulties that we have in the seasonal kind of weather. Other than that, vitamin D is also implicated in as well, but the research kind of supports the fact that if you're deficient in vitamin D, that's where kind of the difficulties kind of arise with our brain chemistry. But we think there's some connection there too.
We always recommend the vitamins usually because I always think B vitamins for brain, and then vitamin D is kind of like your sunshine vitamin. So that totally makes sense.
Yeah, most definitely. And it makes a big difference, especially people that are deficient. I've literally seen people with a vitamin D level of 6 come in my office. I load them up 50,000 IUs and then they don't need me anymore. It's pretty great. So.
Well, Tim, I find this fascinating because this is probably the first podcast I've ever co-hosted or been on that we have a guest this many years younger than everybody else, and that isn't yet speaking. So this is like a little treat for everybody.
I know,
nice. And so fitting.
Yeah, thanks for being so flexible. I appreciate it.
We love
so
it.
Tim, I've helped the biopharma space in a few different ways. So I instantly think of their perspective, which is throw a drug at this, try a therapy at this. And I'm sure that's a part of a recommendation that might come from a leader like yourself. But there's probably all different types of therapies now, aside from a prescribed medication or a supplement over-the-counter treatment. Are there light therapy medications that can be coupled with a prescribed therapy? Do you advise that, or is it really an experiment for someone to have to walk through and get comfortable with?
Yeah, I always love a good experiment. And I usually start with light therapy. So I always tell my patients, just like you want $10,000, remember you're going to want 10,000 lux in your light. And it's just about a half hour to 45 minutes a day. You want it to be arm's length away from you. And it can really make a world of difference. So do it while you're kind of getting ready in the morning, those sorts of things. And just 45 minutes, and it can really make a big difference. Other than that, honestly, make food your medicine. So, getting those good healthy salads in, the B vitamins, those sorts of pieces too. Wellbutrin has some good data with it as well. But honestly, I tend to go with the, kind of natural stuff first.
I love that you went there because the one individual I think of now that's, I guess, a longevity, if you will, influencer, Brian Johnson, had his Netflix debut several months ago, and he does light therapy first thing in the morning, and he'll stand there by the bathroom mirror for about 15-20 minutes, and then he begins his very regimented day. So I think of that, but it doesn't have to be that regimented, as you said, as long as you can fit it in and try it, experiment. So great answer. That was a really cool topic for us to discuss.
And I feel like just a walk might help too. It doesn't have to be so regimented as just standing in front of the mirror. But I feel like just taking a stroll around the block and trying, if you have, I guess, okay, I'm a little biased because I have sunshine here. But if you're in an area.
You have a lot of sunshine.
Yeah. But I guess if you're in an area, just the physical activity of taking a walk, even if it's a cold and dreary one, just having your blood pumping and using that modality of exercise will help.
Especially in the afternoon. So on your desk, putting the light out just for 45 minutes, just arm's length away from you, it can make a world of difference. You'll feel more motivated kind of as your evening progresses and maybe just a little less worn down.
Awesome.
And then is there any room for I know red light therapy is a huge thing right now for skin, but I wonder, is there any research for red light therapy and mood?
Ooh, that's interesting. I haven't read that. And I think the 10,000 lux and the white light, that quality of light is really important. But honestly, I haven't reviewed the research on that. I'd be curious.
What are the early warning signs that someone might be experiencing seasonal depression?
Yeah, I think what I usually see in people is just decreased energy. And then we think circadian rhythms start to be impacted pretty quickly. So, you're sleeping a little bit more. You're not sleeping quite right. You're not getting to bed at the right time. Those sorts of pieces, they're one of the kind of warning signs that things are kind of off in your brain and that melatonin production is kind of picking up. And then there's less synthesis for other brain chemicals and things.
That sounds pretty similar from normal depression. So how would that differ from regular depression?
In my patients, it tends to be more like a cyclical nature, and they feel it creeping on. So it's over 2 to 3 weeks. I just had a patient in my office last week, and they were like, I just have no energy. Happens to me every single year around this time, and then I really can't sleep. So I think it usually comes in about a couple weeks, and it's kind of irrespective of what's going on in their life. But the symptoms tend to be a little less severe than some of the other depressive symptoms that I tend to see, and it more tends to focus on kind of energy levels and those pieces.
I guess follow up to that, you have the gears turning for me. So because it's seasonal depression, let's say it goes away in the summer, do you see patients with cyclical seasonal depression where it's an annual thing and it can't really be cured? It just always happens?
I do, but then I tend to lean into the holistic approaches. So a little bit of supplements. I tend to not lean into medicine. I have probably, of my 600 patients, maybe 6 that go on Wellbutrin kind of over the winter months. But most of the time I can manage it with supplements, exercise, and those sorts of pieces. So think those ways to build your brain chemistry in a really, really natural way. But definitely people tend to know, and I tend to lean into it and kind of ask questions and kind of see if there's that cyclical piece, if they notice patterns right around this time of year. But most of the time people really do know.
I've heard seasonal depression just as a common mouth term for folks to just say, I'm down this time of year. It's coming to the holidays and there's less light and, there's a lot of expenses and travel maybe, or maybe the opposite. I don't have family in the area. And that social impact sitting on someone's emotions can be depressive. So is that true at all? Is that a part of it, or do you think that seasonal depression is more of a longer trend line for someone to be aware of, that it's not just this time of year and it's just the impacts of the environment you might be in? It's maybe a trend line that you need to monitor because you could be maybe clinically depressed.
Yeah, I think that's the main misconception. I think people look at it as just a winter blues. Well, it's definitely more than that, and it clinically impacts people, impacts energy levels, it impacts focus. It really gets in the way of their life. And so really kind of getting away from that misconception about it just being winter blues. Hey, I'm just down in the winter. Well, no, there's probably also a chemical piece to it. If it tends to happen every year and it really starts to get in your way. With mental health, that's really the key, when it really starts to get in your way. And there are treatments, right? So light therapy, it sounds like voodoo, but it's really, really not. We've got dozens of studies to support that. And it's only an hour a day, even 45 minutes is a lot of the protocols. And so it really is super treatable, whether, it's taking a look at vitamin D with your provider, taking a look at CBT kind of skills as well, and kind of reframing how you look at things can really make a huge difference. And just kind of those motivational pieces around, Mary said, getting outside, all of those pieces. So really it's more than winter blues. It has to get in the way of your life, and it is treatable, and we can really do wonderful things with it.
And you did say that a lot of it is lifestyle and managing your own supplements, but when should someone seek professional help?
Yeah, so I think the piece is when it starts to be, a couple weeks and it starts to get in the way of work or your family life or the person you want to be. That's really when you should start talking to your doctor, your nurse practitioner, those sorts of pieces. So, when there starts to be patterns and then it gets in the way of the things that you really enjoy and you can't get out of it on your own. So, you can't get to the gym, you can't eat well, those sorts of pieces, and it starts impacting things generally. I think that's always when to seek medical advice.
It's always hard because there's so much floating out there. Because I know a lot of my patients are teenagers or like younger adults, and they'll be like, "Oh, I saw this on TikTok, and I think I have like MAFFFSS," and they'll like spit out a random like acronym. I'm like, "How do you know about that?" So I feel like a lot of kids these days are now looking towards like social media to self-treat. So I'm like just wondering at what point. But that's a great point that when they just cannot be themselves is a great time to really seek professional help.
Yeah, and some of that can be a really positive things. Awareness is important, so people don't take certain things that they can't on their shoulders. And, when it's really getting in the way of things, seeking kind of professional guidance like me or your therapist and kind of digging into the symptoms of whether they mirror like a clinical depression. So I just think of clinical depression, as a sign that there's an organic difficulty. And then we have DSM criteria for that. And the DSM criteria for seasonal affective disorder mirror that. So that's kind of the big piece there.
Obviously, this is regional, so you're out in Minnesota, you probably get a ton of it. I'm thinking here on the East Coast, I definitely feel it. It doesn't doesn't change my quality of life, and I can like fight it, but I definitely feel like even it getting darker so earlier, like I'm like, oh my God, I'm so tired. And that was like at like 5 o'clock yesterday. My kids were asking at like 5:30 last night if it was time for bed. Like we were all
right. You're like, what time is it? Like, is it really bad time?
With daylight savings. Can you share a story or experience of someone coping with seasonal depression? And my one question to you is with like the cyclical medicating, I do find, although this is a little bit different but very similar, like some people have massive anxiety and depression around going to school and stuff. So a lot of times how I frame it to people, it's like you're not on these for life. Like if you need these for 8 months, it's okay. Obviously we're going to wean you off and wean you on safely, but I think that's another thing that I like to touch on with their patients when they're in like these very seasonal or episodic episodes.
Yeah, and that's one of my kind of experience as well. So I had a 17-year-old girl in my office last week who thought she had seasonal affective disorder. We did lab work. Her vitamin D was kind of borderline in the low 30 range. So we added a little vitamin D. Like for good mental health, we want that kind of in the 50 range. Then we took a look at kind of food and exercise and those sorts of pieces. And that was kind of the trend for her. So she stopped going to the gym. That's really helpful for her. She stopped kind of eating really well. She was skipping school a little bit here and there. And the gym, I think, is the really missing piece for her, and then you kind of get down on yourself on those sorts of pieces. And then it just feels like, oh my gosh, I have like 6 months to get through. So working kind of those CBT skills are reframing kind of that way of thinking as well. Hey, you will get through this. This isn't, kind of the end of the world. It's a few months and it's predictable that way. So we took a look at labs. We decided to kind of hold off on starting any Wellbutrin right now and see how kind of exercise and good food and those sorts of pieces kind of help her. But, we're definitely keeping a close eye on it. And then it's social support as well. So who can you like buddy up with and get to the gym with to make sure you get outside or, get to the gym, those sorts of pieces. But honestly, medicine isn't the answer a lot of times. It's just kind of adapting to how your brain works and how your brain works every winter.
Yeah. My neighbor keeps me accountable.
So we
go to the gym. Gym every morning at 6:15, and like once I like slack a day or two, I get called out. I'm like, oh, I'm like, all right, got it. Gotta get back on the horse. But yeah, I mean, I'm very open that I like since adolescence, that anxiety and CBT has been like the best thing for me, not only personally but professionally as well. So like when things don't go my way, it's like, okay, I don't like catastrophize it. I'm like, all right, you're gonna get through this. This is a low point, but like, how many other things have you gotten through? So I think it's just like a great life skill too when people can actually lean into it.
Yeah, our thoughts, impact our actions, and it's a big circle. So if we can kind of stop that process and break that process when it comes to this too, like the motivation picks up, the energy picks up. And once we get a habit going, it can make a huge difference for people. And exercise, I always say it to all my patients, it really is the silver bullet pretty much for everything. So whether it's inflammation in our body and how we build our brain chemistry, helping our brain chemistry be built, like helping that conversion between tryptophan happen within our brain, it really can just help with so much. And then if you can't pull it together with those sorts of pieces and good food, that's kind of where people like me kind of come in, maybe with a little extra medicine boost. And I think just baby doses of Wellbutrin can really, really be helpful because it can be activating, like you mentioned, and kind of lead to anxiety and those sorts of pieces. That's why I think holistic treatments in general are just a little softer, a little bit more helpful, and then it really empowers people and they kind of advocate for themselves too.
I totally agree that it takes just like a few habits every day. So I teach Pilates in the morning usually before going into work. And that's like my motivator also to work out because I'm already there. There's no excuse like you have to do it. But I always tell people, I'm like, even if you just try something different for 2 reps today, it'll become 3 tomorrow. And then by next week, it'll become a habit. So just like taking it little by little, I think is really important. And I think with a lot of our patients and like seeing them longitudinally, just having someone check in on you once a month and ask like, hey, did you schedule that PCP appointment? Did you finally reach out to Tim? Like, do you know when your appointment is with Tim? Just having just the little things that build a date on a day-to-day basis definitely help people, especially when it comes to like working out and stuff. And I wish health insurance covered gym memberships because that's one thing that our patients ask us all the time because they can't afford it sometimes. And in colder areas, it's hard to like just get outside and run.
It is, and they're getting so expensive too. I mean, there's the Planet Fitness in the world, but I mean, really, it helps us so many different things, and it helps us avoid more costly treatment. Yeah, that doesn't make a whole lot of sense to me too. And we have research to the effect of like going to the gym helps your focus throughout the day, right? It's going to boost dopamine. It's going to help with norepinephrine, all of those sorts of pieces too, which are a lot of the same chemicals that kind of help with seasonal affective disorder. If we think of Wellbutrin, like that's exactly what it's targeting. So if you can hit the gym, kind of get them up that way, like it can make a big difference.
Yeah, you can tell the days that Jenna does in the morning.
Oh, I'm freaking ready to rock. It's a lot. I'm already a lot. So that's an extra lot. I just wanted to say a few pharmacy dorky plugs. So like obviously the vitamin D, the B12, I need B12 shots because I have celiac, Tim, so I don't really absorb it that well. And all that can be covered under your insurance for like the patients most of the time, not all the time, but just something to think as far as cost savings. And then for Wellbutrin, you said something that not a lot of providers appreciate, which is it can be activating and cause anxiety. So that's a very common misconception. It's not going to treat your anxiety. It will help your depression. The other fun dorky pharmacy fact, which Tim, I'm sure you already know, but for our listeners, like my biggest bugaboo with Wellbutrin is that people don't screen for seizures and then bulimia and anorexia past medical history. And that's like where I find so many times that like a provider missed that screening and then God forbid, many times they've gone to have seizures. So just getting a little dorky on the clinical pearls of Wellbutrin for our listeners.
And I think people like it because it doesn't tend to have some of the side effects, and like it does have side effects. It will decrease your appetite, and if you're not eating, you're not building your brain chemistry well. And then I think people often like the energy boost, and they mistake energy for focus, which can kind of be problematic in and of itself too. Like they're like, hey, like I can do things. And like, are you checking in with your anxiety? Are you checking in with your body? All of those sorts of pieces that can really impact your life as well. But it's not side effect free. I think other nightmares too are one of the more like disturbing side effects that I see people have. And they're not just nightmares. They're like vivid nightmares that people are just like, this is really upsetting. And I think a lot of providers miss that as well, right? Like if you're acting out your dreams and accidentally hitting your spouse in the middle of the night, like that's probably not sustainable. So it's definitely not side effect free. And then I think a lot of providers tend to like increase it, into the 450. But if we're not getting benefit at 300, like I don't think there's much reason to go to 450, in my opinion.
And then what role do you think pharmacogenomics plays in seasonal depression?
Oh, well, I mean, I could go on for ages on that, but I mean, you can look at the testing and you can have hints into your brain chemistry, right? So how do you break down your brain chemistry in certain parts of your brain? That's incredibly helpful, right? Like if you have a val-COMT, like I know, for example, you're going to break down dopamine and norepinephrine more quickly in your brain. If I know that, it's those patients that do tend to struggle with seasonal affective disorder a little bit more. They burn through it. So we're going to talk about how to get those things up and in a really healthy way. And then how you build your brain chemistry. Do you have the MTHFR genetic mutation as well that makes that tougher and can lead to more inflammation and those sorts of things too? And I think like it really empowers patients too, right? Like if you know what medicines work well with your body, like you can do the digging, and I'm never intimidated by that. So not only do we know like how you build it, how you break it down, and then kind of how you even transport certain serotonin kind of markers and those sorts of things, like it's fun stuff. Like it can make a big difference for people.
Yeah, I always tell them it's like the blueprint of your medicine. Like in my world of perfect worlds, everyone would be born with pharmacogenomics like already set out. So then you already know, instead of guessing for the rest of your life and like kind of shooting in the dark on what will work, you actually know like what you're susceptible for, what will work best for you at what dose and what frequency. So I just think it's like amazing. And I'm so glad we align on that.
It's super important rather than just increasing medicines. Now, the research can be a little bit mixed about, improving outcomes, but a lot of those studies, it's tough, right? Because like these are hard to treat people in general. They have treatment-resistant depression, those sorts of pieces. So we have to look at the patient and not treat them like a textbook. And I think, gene site testing really allows us to do that. And then they have faith kind of in the medicine that we're choosing. And then we can use the lowest effective dose as well. Like if they burn through a medicine, like maybe I don't want to use that medicine because essentially I'm going to get to have to higher doses with it. And then you can get side effects because, the anxiety and depression, that's implicated in where in your brain, right? But then you're going to have systemic side effects as well. So I never want to use a high dose of a medicine if I can avoid it. But GeneSight kind of gives you that blueprint to all of it.
Well, Tim, this has been fascinating, in particular for me, because I think you're more, I don't want to say on the functional end, but you're more on the living end of how someone can be more thoughtful in treatment of this time of season and maybe these types of symptoms, rather than just a single track of, hey, prescribe this, or hey, just do this. You take a multifaceted approach of looking at what might fit for someone's maybe cultural competencies in health and understanding in their own world that they're living in on a day-to-day basis. So really insightful things. And thank you for the extra guest on the show as well.
No problem. I really think the functional multidisciplinary approach is how healing happens because everybody's a little bit different and we have to do what works for them and take the time to kind of learn and see what works rather than just throwing a medicine at it. That's the easy approach.
Awesome. Well, thank you so much for joining us today. It was honestly amazing. And I'm like thoroughly impressed that you have the gene mutations memorized. I wish I had that kind of brain power, but that was pretty awesome. And I have one last question for you. What was your TikTok video on? I don't have TikTok, so I wouldn't be able to see it.
Oh, what do you mean?
When I emailed you about seasonal depression, you're like, oh my gosh, I just did a TikTok video on it.
Yeah, how to spot it. And then I talked about, the lamp actually having, or the SAD lamp having a lot of research to support it. That's the main thing I hear from my clients. I think it's kind of, hokey and then I'm like, well, we can pull up like the 10 studies together. And so it's just a simple $20 on Amazon that can make a huge difference. So I just kind of touch base on that with TikTok in kind of a fun way.
Awesome, love it. I need to steal a phone from someone that has TikTok.
Yeah, find me on there. I think I have quite a few videos out there now. It's kind of fun. And there's so much misinformation out there that we kind of need to combat that as professionals and come together to do it. So you should get on there.
Oh, we'll see how good I am at that. But thank you so much for joining. I hope you have a great week.
You too. Nice to see everybody.
That's all for today's episode. Thanks for listening, and remember to subscribe on Apple Podcasts and leave us a review.